Welcome to Caregiver Cast with Elaine Petrucci. Are you overwhelmed raising a family, working full-time, caring for a parent or grandparent? It can be challenging when you're doing it alone. Caregiver Cast helps busy, burned-out professionals reduce their stress and overwhelm to create a better caregiving experience for themselves and their loved one. Caregiver Cast brings caregivers together with experts who provide information in a variety of areas. In each episode, you'll get tips on topics such as finance, legal, medical, self-care, community resources, mindset, and more. We're here to make your caregiving journey a more rewarding one. Acquire the confidence and skills to be a more capable caregiver by implementing the resources and strategies from these expert thought leaders. Get a community of support, resources, and strategies for your caregiving journey inside the Caregiver Lifeline community. Visit caregiverlifelinecommunity.com. And now here's your host, Elaine Petrucci.
Hi, welcome to Caregiver Cast. I'm Elaine Petrucci, your host. My guest today is Nastran Andersen, who will be talking to us about how caregiver isolation as a health risk. Before I formally introduce Nastran, I'm going to give you some background information about her. Nastran is Trualta's Chief Financial or Revenue Officer, responsible for new business growth, marketing, and client success. A seasoned healthcare IT veteran and passionate patient advocate, Nastran has spent the last 2.5 decades, with the healthcare technology companies that serve provider, health plan, and community-based healthcare organizations. As an inquisitive leader and natural conversationalist, Nastran has secured a reputation for collaborating across organizational boundaries with a focus on building teams, gaining trust, and driving results for her clients. Her approach focuses on turning strategy into action, helping the businesses she serves at every stage of growth, translating their ideas into operational success. She holds a bachelor's degree in psychology from the University of Georgia and an executive leadership certificate from the Wharton School, University of Pennsylvania. Nastran lives in Atlanta, Georgia, with her husband and 3 children. Welcome, Nastran, to Caregiver Cast.
Thank you, Elaine. I'm so happy to be here.
Can you explain how you evolved into Trualta and what it is and how it helps caregivers?
Yeah, absolutely. And thank you for having me as the guest today. So in my background, so I've been in healthcare IT, as you mentioned, for the past 26 years. And so working across all of these various organizations that are serving primarily the clinicians, that's where I've been focused in my career, is how do these technology applications enable the clinician workflow, capture patient information, really think through that care coordination across the healthcare ecosystem. But what was really drew me into Trualta was thinking about the family caregiver as a more active member of the care team. So I think all along those family caregivers have really been considered on the periphery of the care team, at least by the healthcare organizations themselves. And so having that, enabling the family caregiver, having solutions that enabled them to, and that education that enabled them to be a more active member, to feel more empowered, to participate in the care team, and to really contribute to the health and well-being of their loved ones, whether that's a family member, whether that is a friend or a neighbor, their partner, how we can accomplish that. And that's what really Trualta is all about. So Trualta is a caregiver education and support platform. And our focus is on building caregiver skills, and because we want them to feel confident about the kind of care that they're providing to their loved one, to their family member, so that we can improve the at-home care, as well as reduce caregiver burnout. So in addition to the education and support that we provide on our platform, we also have virtual support groups and community features, community chat features that help connect caregivers to each other.
Wow, that seems very comprehensive, and I really appreciate your focus on caregivers as being a member of the team, because like you said, they often are ignored or not taken seriously, and they really operate in isolation. And just having that knowledge that they can become a part of the care team is so critical. And it's nice that you have that platform for them to really talk with one another and get more support, which is extremely critical, because a lot of caregivers don't look at self-care as a priority.
Yeah, absolutely.
Can you please provide some context about caregiver isolation as a health risk?
Yeah, certainly. So as many people know, and we hear these various statistics that are shared, but there's estimated to be 53 million family caregivers in the United States alone. And really, these caregivers feel very alone due to the nature of their caregiving role. So if you think about it, they're revolving their life around providing care in the home. And so they have to be home a lot. So
Yeah.
they don't get out much. They have limited personal time. They have to abandon their hobbies. They often withdraw from their normal social life. And so that means their support system, their own support system, the family and friends are becoming more and more distant as time goes on. And so they feel like, with all of those compounding factors, that they don't have anyone to talk to about what they're going through, because they're embarrassed, or maybe they're feeling like, oh, I don't want to bring this up now that it's been so long since I talked to someone, and that I'm doing this. And so as that goes on, and it can last many, many years, the being in that role and serving in that role as a caregiver, and it can be an incredibly lonely time. Just last year, the Surgeon General released a pretty startling report about the epidemic of loneliness and isolation, and that people who are lonely are at a much greater risk themselves of cardiovascular disease, dementia, stroke, depression, anxiety, and unfortunately, even premature death. And so the mortality impact of being socially disconnected, and this was cited in this report, is actually similar to that caused by smoking up to 15 cigarettes a day. So we hear, it's like, here are the kinds of things it is. And it's, again, it's in this US Surgeon General report, but that's the health impact. And so that caregiver isolation is a tremendous health risk, not only for the caregiver themselves, but certainly for the person that they're caring for.
Most definitely. I've heard that about, excuse me, about 30% of caregivers die before the person that they're caring for.
Mm-hmm.
And that is a horrible, alarming statistic, to think that you're giving everything you can to your loved one, your friend, or your partner, and yet that it really has such a devastating effect on your own health.
Yes.
So let me ask you, I know that there's going to be another 76 million baby boomers retiring by 2030. How will Trualta be, I guess, at the forefront of helping caregivers early on in the next 7 years to prevent, I guess, a healthcare crisis for caregivers?
Yeah. Well, so what we're trying to do, so with Trualta, we're partnering across various organizations. So we work with healthcare payers, we work with provider organizations, we work with government and social service organizations as well. Those are all of our clients, if you will, that are bringing we're bringing our evidence-based offering to families. And that's how we're reaching these families. That's how we're reaching all of the caregivers themselves, is through those healthcare organizations and social service organizations that are trusted and known entities to the individuals, to the caregivers themselves, so that we can improve those health outcomes. But specifically how we're addressing and how we're thinking about social isolation for caregivers is, like I said, they don't know where to turn to for help or specific answers. And so our platform really serves as a handbook for the family caregiver. And we have articles, videos, and various modules that relate honestly to hundreds of different caregiving situations. So it could be specific to a health condition, such as heart health, diabetes, Alzheimer's and dementia. It could be, a mental illness, mental wellness, Parkinson's, a stroke, any range of conditions. And so the caregivers can learn based on either those conditions or even condition agnostic, like how do they manage medications? How do they safety proof the home? How do they help with activities of daily living, toileting and bathing and teeth brushing and helping that care recipient? But in addition to those pieces of being a handbook for the caregivers, we're also offering content on self-care. So because we know how important it is for the caregiver to stay healthy themselves, in order to provide the best care for that recipient, is that self-care is really making sure they're maintaining relationships and maintaining an identity, a personal identity outside of their caregiving role.
Thank you so much for answering that. How can you tell me a little bit more about the community features that complement the education platform that you have currently?
Yeah, absolutely. So we knew we always wanted to give caregivers a way to connect to other caregivers and to caregiving experts. So that is what really drove us to create this Trualta community, is that we didn't want caregivers to ever feel alone. So this past year, we introduced a chat feature. So that's one of the ways that we're doing that. That chat feature serves as a forum for different caregiving topics. So if you can imagine like different social groups or social communities that are online, this is quite similar to that, where caregivers, they can post about their own experiences. They can share tips. They can say, hey, this is how I've handled this in my family situation, in my home situation. And likewise, they can learn about what others are going through. So we want people to feel with that they're not alone, and that they have that community to share those resources with, recognizing that maybe some of the most impactful tips that you can receive, the education pieces are great, but if you're hearing from someone else, this really worked well for me, and that situation resonates with you and is quite similar to the situation that you have, then they're establishing that community with resources. Another way that we're doing that is we actually offer virtual support groups, and those support groups have been a great success. Caregivers, they log in from home. They can either participate via video, or they can be off camera if they need to, but they meet with others that are going through similar things. So we have pretty targeted topics. So a virtual support group may be focused on spouses with dementia or Alzheimer's, or it could be focused on, managing anxiety and PTSD with their family member. And they're meeting with others that are going through similar things. So we actually found, after a 4-session cohort where they're meeting together as a group over 4 sessions, 99% of the participants reported lower isolation, and 75% continue to come back. So we have, having that retention rate, and really excited to see how that continues and evolves. And then the third way that we're addressing is that we also have webinars. And so caregivers can join those from home. And again, and just, wherever that they are able to connect. And our most popular topics on the webinars that we provide are related to self-care. So we actually see a 10% increase in our own webinar attendance rates when the topic is related to caregiver wellness. So it could be, how they're taking breaks, taking advantage of respite opportunities that may be provided through one of their healthcare organizations, or even exercise, and doing a little bit of activity, but certainly things that are focused and so that on wellness. And that's really telling us that those topics are very important and very much needed by the caregiver population.
That's amazing. So are they learning about Trualta from like their healthcare provider or organization or healthcare plan so that they can have access to the services that your company provides?
Yes, that's typically how they do, is learning from. So that we're actually available in 32 states. So we certainly encourage the caregivers to check with their health plan, to check with their healthcare provider, or their local area agency on aging, and see if they offer Trualta in your area. And the great thing is, it's not only the Trualta platform. There's certainly, with those other organizations, they're thinking about engaging caregivers in multiple ways. So there are other support programs that are offered as well. And, another way that they could look at it is, if they want to look on the Trualta website, then we can direct them to a portal in their area as well.
That sounds amazing to me, that caregivers have such, I would say, kind of easy access to these materials if they would only ask. And that's another issue. Asking is a really tough thing for caregivers. So what have you learned about supporting caregivers, and what services or education you have already talked about make the most impact on? You said it was usually on self-care. Do you do topics like boundaries or financial information, that kind of thing?
We do. We actually do have those, the whole range of topics, as I mentioned. It's not all specific to a healthcare condition. There's boundaries is included in there. Family dynamics, as we enter the holiday season, navigating the family dynamics or navigating the holidays, which can be challenging and a very emotional time for people, but you're also bringing together extended family and groups that aren't necessarily there on an ongoing basis. You hit on an interesting topic of caregivers not wanting to ask for help, or just, not wanting to burden anyone else. There are really interesting statistics about, do caregivers really identify as a caregiver? And in fact, that's more than half of them, greater than 50% of them, don't even think of themselves as a caregiver, which means that they don't know how to seek help. They think that I am a good spouse, I'm a good partner, I'm a good daughter, a good son, a good brother. I'm caring for this person because that's what I'm going to do. This is my loved one. And they don't identify with the word caregiver. So that's something that we're always thinking about, is how do we make sure that we're engaging people, or at least offering these resources in a way that they would say, oh, wait a minute, that's me. That is something that I'm doing and how I'm providing. So I think that's a key piece of it, is really just, who is a caregiver? Who is that person? And caregivers really experience so much guilt that they're often unwilling to share the struggles with family and friends. That again contributes to that social isolation. But on that guilt topic, so, there's a lot of our popular content, in addition to the wellness piece, is around guilt. It's actually, on wellness and guilt are actually more popular than our condition specific content. And then that need for that connection, and to say, wait a minute, this is a normal feeling that you're experiencing. This is exactly what other caregivers are going through. And that need for that one-on-one connection is huge. Our care educator, her name's Monique. She really has become a bit of a celebrity within our platform, and engaging other caregivers, and thinking through and moderating and sharing how other caregivers are on a similar journey, and how they can help each other. So with access to Monique, with access to a care coach, that's another a person who would help in more of a one-on-one situation. So they can guide them through that journey, in addition to connecting them to the resources on like the Trualta platform, is connecting them with local resources, and giving that additional community support where someone may not even realize, oh, I didn't know about my area agency on aging, or I didn't know about this community group that is happening at my local library, perhaps. So those are things, once we know that these local resources are available, that's something that we list within our Trualta platform, so that people know these are the resources local to my community, or offered potentially by my health plan, my payer that I'm working with. So, and then on our events, just to spend a little bit of time there of how we're these classes, and how that we, the community. So we have usually about 200 registrations per event for these live webinars. 96% of them report that they learned something new.
Okay.
And 82% of people are reporting lower isolation scores. So they're feeling, even when they attend something as simple as a webinar, they're feeling very energized, and feeling like there's someone who truly understands, and that they're not feeling as isolated. Knowing that someone else out there is experiencing the same thing that you are, really reduces that isolation.
That's amazing. So you brought up a good point. Yes, people don't identify as a caregiver. So how are you and your partners identifying who those are, and how what if anything they're being identified as, in order to get the information to them in a more, I guess, expedient way?
So when Trualta partners, so certainly we're putting out, different marketing materials, different information that focus more on some of those challenges that we know that caregivers experience, as opposed to saying, if you're a caregiver and you need this, we'll say, are you helping someone with their activities of daily living, or are you helping someone with bathing, or is someone in your home experiencing confusion and agitation? We try to focus on maybe the challenge that they're experiencing, in order to then that will resonate more, so that they'll say, yes, this is something that I'm experiencing. And then once they get into that first module and listen to or read an article, or go through one of our education scenarios that are on the platform, then they say, oh yeah, this is me, and I want to learn more. I want to explore more content. And then they start to realize, oh, I am a caregiver. That's me. So that's one way that we're doing. And then we also provide very similar marketing support to our partners, to make sure that as they're trying to engage caregivers and the various folks in their community, we provide that marketing support to our clients that we work with, so that through social media, through printed materials, through community organizations where they could let people know that this is a resource. We're trying to show up where they are, and really be a good partner to reach as many caregivers as possible.
Thank you for doing that, because I, as well as other people in the caregiving space, have found that a bit of a challenge of how do we attract like the caregivers so that we could provide like the services that we offer, such as you. So I'm really pleased to hear that you're working and looking at just some of the issues that a caregiver can encounter when they're caring for someone else, in order to get them to your platform so they can receive the support that they need. So kudos to you. So where is Trualta, and where can listeners get access to it?
Yeah, well, so as I mentioned, we are working with the health plans, with the healthcare providers, the hospital and health system organizations, as well as physician practices, and then the area agencies on aging. So that would be the first place, is to ask and say, you know, do you have, are you working with Trualta, or, you know, do you have a caregiver training platform? Often, you know, there will be someone who is a member of the care team, a care educator, or a care manager person that would be within one of those provider or health plan organizations. The other place, like I mentioned, is on our website, so trualta.com, and it's TRUALTA.com, where we can help direct them to a portal in their area, but provide them with some initial resources too, so they can understand this is the kind of content that I could expect. These are the community groups or the support groups that I could participate in. They can find information on our Trualta.com website.
Fantastic. Can you give us 3 takeaways about how important it is for caregivers to access your resources so that they can avoid caregiver isolation?
Yeah, so I think the top 3 takeaways would be, number 1, making sure that you're healthy and well, so that you can continue to take care of your loved one, and really knowing that isolation is contributing to a health risk for yourself. I think that the second one would be, even though it feels heavy, it feels like no one else is experiencing what you're experiencing, there are people who are experiencing what you are. And so being connected in and knowing, oh wait, there is a place for me to hear from other caregivers. There's a place for me to hear from others who are experiencing the same kind of challenges and family dynamics that I am, to make sure that they know that there are resources there. And then of course, ask for help. It's okay to ask for help. Just, you know, the people are, that guilt is such a heavy component, a heavy emotion, but this is where there are so many organizations that are wanting to provide resources so that the family members can stay home longer, that they can be healthier, but asking for help or seeking a resource is really important to be able to continue to keep your loved one at home and to be healthy yourself.
Oh, definitely. So thank you for those 3. So yes, they you know, ask for help, of course, which is a challenge for many caregivers, but just to meet other people who are going through the same situation and can give you the support, so you don't feel like you're in isolation and you're doing it alone, and without help from, you know, neighbors or family members. So I appreciate you giving us those 3 takeaways. Can you?
Absolutely.
My understanding that you have a free offer for our audience. Could you explain what that is, Nastran?
Yeah, we do, and we're so happy to offer this. So sometimes we offer pretty often to our clients, especially for those who might not have access to internet regularly, or if they don't have access to the Trualta platform through one of those organizations that I mentioned, who we're already partnering with. It's basically a download of all of our kind of most popular and some of the easiest to apply content. So we've taken some components of our various education toolkits and we've put it into a booklet for you. So you can download that booklet and it's packaged together for you. There are some specific pieces of caregiver wellness. There are some checklists, things that you mentioned earlier on, Mary Elaine, but with emergency preparedness or medication management, those kinds of things of like, how do I, some more practical tips that apply to caregiving and lists there. So those are all packaged together in this download, and just so that caregivers would have an immediate resource to look at. So those are all included in there.
Thank you so much for that resource. I think that's what caregivers often find, is that they're taking over in an emergency and aren't really equipped to be able to handle it, number one. And then they need to have like all those checklists, like you've mentioned, done prior to any event, significant event occurring, so that, you know, the caregiving can start and be seamless instead of trying to find an attorney or something to do to give be a medical power of attorney, for example, so that they can at least participate in the person's care. So I appreciate you having that download available, because hopefully that will be an eye-opener for people to start really having those conversations early with their loved one, so that they can have a more powerful and enjoyable caregiving journey. So thank you for being here. I really appreciate it, Nastran.
Absolutely, Mary Elaine. It was a pleasure to be here. And yes, anything that we can do to make it feel less overwhelming, lift a little bit of the burden. That's exactly what Trualta is intended to do, is to be that guide, that handbook, as I said. So if this download is a start, at least it can help people get certain pieces out of the way and recognize, oh, there are resources out there that can make this less overwhelming for me. Then that's what we're hoping to provide, what we're hoping to solve for. So thank you so much. I appreciate the work that you're doing as well to provide these kinds of resources to the caregiver community, and everything you're doing to elevate these different resources and exposure, so that people know what's out there. They know where to go.
Yes, most definitely. Yes. So I really appreciate what you're doing, because you're offering a great resource to caregivers so that they can get everything that they need in one place, and they don't have to search through the whole internet to look for resources that may or may not be, appropriate. You just never know the information on the internet. So thank you so much for your company, you and your company, for providing this service for caregivers. Thank you.
Yes. Well, thank you. Thanks, Mary Elaine.
Thank you for listening to the Caregiver Cast today. Get a community of support, resources, and strategies for your caregiving journey inside the Caregiver Lifeline community. Visit caregiverlifelinecommunity.com. Get involved with the show. Send your email to mpetrusi2002@gmail.com. And we'll see you again next week for another episode of Caregiver Cast.